Hello, I'm Dr. Gireesh, interventional cardiologist at Nanticoke Cardiology and the Nanticoke Vein Center. You may have questions about varicose veins. I want to take a couple minutes to talk about varicose veins and the treatment options at Nanticoke. Veins bring blood from the body back to the heart, which is then recycled throughout the body. Normal veins are small and have properly functioning valves that act like doors. These valves prevent blood from flowing backwards because of gravity. Varicose veins are enlarged and twisted veins in the legs. When veins become enlarged, these valves don't work properly and blood pools in the legs. If left untreated, they can become larger. They can also get worse as you stand and can be very painful. There are many causes for varicose veins. Typically, they are more common in women than in men, but that's not to say that men don't suffer from varicose disease. Genetics play a big role, and often patients will tell me that varicose veins run in their family. Other causes of varicose veins are pregnancy, menopause, and aging. If patients have had trauma to their legs or surgeries in their legs, this can cause them as well. Some folks who stand for long periods of time because of their job will develop varicose veins. Having a history of clots in the legs can also cause varicose veins. Being overweight is a common culprit of varicose veins as well. Patients with varicose veins can have a different number of complaints that can be treated. It's important to talk to your doctor about any discomfort that you may be having in the legs, even if you don't think your symptoms are coming from your veins. The majority of your symptoms will occur at night. You can experience heavy legs or aching, ankle or leg swelling, cramping, as well as restless leg syndrome. You may notice that your skin color around the lower portion of your legs, particularly around your ankles, have turned brown or more scaly. For the most part, varicose veins are fairly benign. I often tell my patients that varicose veins are a nuisance more than anything else. If left untreated, they can lead to what's called venous insufficiency. The varicose veins are located on the outside portion of the legs or in the superficial system. Eventually, the pressure in these varicose veins empty into what's called the deep venous system. When this happens, you develop what's known as venous insufficiency. The most common consequence of varicose veins and venous insufficiency is pain or cramping or achiness. There can be long-term effects, however, such as chronic skin irritation, skin ulcers, and wounds that don't heal. Superficial blood clots, bleeding from minor trauma can also occur. In a small population of patients, skin ulcers from venous disease can lead to skin cancer. Everyone is at risk for developing venous insufficiency. It's a significant public health problem in the United States. Chronic insufficiency affects up to 5% of all Americans, and depending on whom you ask, 40% of Americans suffer from clinically relevant varicosities. The ulcers I talked about affect 500,000 people in the United States. Those in particular who are at risk are folks who have a family history of varicosities, are overweight, have had children, have had clots in their legs, whose jobs require them to stand for long periods of time, or have had trauma or surgery to their legs. There are many different treatment options for patients with varicose veins with symptoms. The most important thing to keep in mind is that venous symptoms are not something that you have to live with. Further, the majority of treatments are covered by your insurance. Treatment options are very much patient individualized based on your symptoms and how aggressive you want to be with your therapy. It's important to talk to your provider about your symptoms first and foremost. At the Nanticoke Vein Center, we're able to provide services needed to treat venous insufficiency, which range from sclerotherapy to ultrasound-guided sclerotherapy, stab phlebectomy, endovenous thermal ablations, as well as some of the more complex therapies like deep vein stenting. For more information about varicose veins, call 302-628-6222 or visit nanticoke.org/vein center.